Well, welcome back to another episode of The Compass. I'm here with Brad Robison, MD. Today, we're going to talk about the complex and often misunderstood topic of male depression. Did you know that men are actually less likely to seek help and may not actually recognize traditional symptoms like sadness? And I want to know, what is the reason behind that? Why are men less likely to recognize the traditional symptoms of depression?
I mean, I think there's a lot of issues, and as we're moving into the winter months, like fall is upon us, and moving into the winter months, I think depression in general is a good topic because the seasonal depression is a real thing, and then men do tend to be less likely to recognize symptoms, and even when they recognize symptoms, they're much less likely to pursue treatment. And I think a lot, I mean, maybe some of that's changing, but I still think a lot of it goes back to stereotypical, male, you know, role kind of, uh a sense of being tough, being,
Yeah, those
well,
traditional gender roles. We've talked a little bit about those on The Compass.
yeah, yeah. And so I think a lot of it goes back to those kinds of things. I think a more modern, and it's maybe beyond the scope of this, but a little more modern kind of reality too, as you know, that there is increasing research to suggest, even in boys growing up. I mean, thankfully, I mean, again, I'm not saying it's a bad thing. I think it's a great thing that we have really emphasized in the last several years supporting girls and, young women and all of that. I think, unfortunately, there's been some casualty there where boys haven't gotten as much support and attention, and so unfortunately I think that has further perpetuated as boys grow up into teenagers and teenagers grow up into young adult men, uh the sense of not really seeking help or support, or kind of normalizing just feeling sad or down or bad, or well, that's just life and I'm just gonna push through and ignore it. So I think those are all issues that are a reality out there.
Do you think that men may identify more with symptoms like fatigue or irritability or even anger? And is anger a side effect of depression in men?
Oh yeah, yeah. I mean, I think part of the issue there now, you know, anger is kind of the final common pathway of all emotions in some ways. I mean, oversimplification, but and it's also, so men and women can take a lot of different emotional experiences and turn it into anger. But for men, it is still, fortunately or unfortunately, it is still a stereotypical male. Oh well, that, well, he's just a guy, or he's just a, that's just what how guys are, that
Mhm.
they're angry or irritable, or and so I think that is a significant part of the issues. Hurt, sadness are much less accepted emotions and topics of conversation for men than, you know, venting to your buddy about how pissed off you are about something.
Mhm.
That's much more socially acceptable in lots of ways for men.
Well, I think too, from my perspective, and please correct me if I'm wrong, but it seems like men try to self-medicate. You see men sort of leaning into drugs, or I've known men that they're in a family situation and they might sneak out to drink alcohol in their car, and nobody knows what they're doing, and then come back inside.
Yeah.
That way, I guess, to just try to handle it on their own, treat depression on their own, maybe not even knowing it's depression, but trying to maybe escape or find a solution.
Yeah. Yeah. Huge. I mean, a huge problem. I don't know what the statistics show on that particular issue recently. I think it would be interesting, and at some point maybe I should go back and look. I'm sure somebody's kind of tracked that kind of data. I don't know what the statistics on that are recently, from the standpoint that I think women are unfortunately gravitating more and more to that too.
Mm,
You know, but men traditionally tend to try to take matters into their own hands and self-medicate, self-treat, ranging from various substances to, pornography, to just, workaholism and things like that. And I think that is a significant issue. And I think that may even segue into a little bit about talking specifically about what depression is, because, like,
that was what I was gonna ask, because how
what
could you differentiate workaholism and risky behavior
yeah,
with an underlying,
yeah,
depression?
yeah, because, like, some people, or, guys, would be listening to this conversation going, well, what's wrong with that? What's wrong with working hard? Well, we're not talking about just working hard. We're talking about, a an attempt to self treat. Well, let me put it like this. It's like, if you can work hard and it does in fact overcome the issue, great. But it's a lot. Depression, untreated depression, can be a lot like an untreated abscess, in the body. It's like, well, if you're figuring out ways to deal with it and it is truly getting better, great. That's good coping, right? If you're continuing to ignore it and you're putting some kind of superficial, band-aid on it, or a salve of some kind that
Yeah.
sort of keeps it in check, but you still have this big red pussy abscess there that every time your wife bumps up against it or somebody bumps up against it, you lash out in pain and anger.
Mhm.
Your self-medicating's not really doing all that good a job of solving the problem.
Yeah.
And so then understanding what the problem is then becomes really important. And the problem, the problem with depression is that it's a persistent negative mood state.
Mhm.
Everybody gets depressed. Sure, everybody has some sad times. Everybody feels hurt at times. That's normal. We need to all learn how to deal with those things, um, you know, um, and learn how to cope in healthy ways. But there are times when depression, clinical depression, major depression, the DSM-5 criteria for major depression, um, are there. It's a excuse me, a persistent mood state, persistent feelings of sadness, recurrent and persistent negative thoughts about the self world and others. It's this ruminating negativity that persists. It's intrusive and persistent hopelessness that can at times include suicidal thinking. And you're really talking about a persistent mood state for days, a week or more, and sometimes significantly longer than a week. um, and when that is really persisting and it's truly disrupting life, family, work, it's disrupting relationships and life goals, it needs to be addressed, like the abscess needs to be addressed. It's like, okay,
Mhm.
I've been trying to cope with this, but at some point I've got to step back and go, I need to take a look at this and really figure out what kinds of treatments are going to be helpful. um, And I think that's, something that I hope men, women that would be listening to this would step back and go, okay, if you've got a persistent pattern of those symptoms that are disrupting, step back, take a look at it, talk to somebody, talk to your doctor, talk to a professional. Now, then that's got its own stigma and struggles, right? That men struggle with, stereotypically struggle with more than women, of actually going and talking to a doctor, talking to a therapist, talking to a psychiatrist, a counselor about those things.
Mhm.
It's not something that people are just saying, oh yeah, that's great, sign me up. Well, um,
When you look into the different options for therapeutic approaches, at what level do you say medicine is kind of the option for this person? And then how long are they on medicine? Is it permanent? Is it seasonal? I know you said some people have seasonal depression, but is it to try to bump them up and then coach them out of it? Walk through all the different, therapeutic processes.
yeah. I think that the first thing in that, well, I mean, men have to kind of come to terms with the fact that, okay, there really is something here. And then also begin to come to terms with the fact that there really is effective treatment. Um, and, the treatment modalities that we have aren't perfect, but there are lots of treatment modalities that are very effective for depression. And the starting point really should be good therapy, good counseling support, and that is probably one of the hardest things for men. But the research supports the fact that to come in to work with a good therapist that can really help you um, identify the patterns of that depressed thinking and the cognitive distortions of that depressed thinking, and then develop some strategies to effectively change those patterns of thinking over time. And again, that's hard for guys to kind of sort out, because most guys are going to look at that and say, well, that's what I'm doing. Well, again, if it's working, if what you're doing is truly working, then great. But if it's not, if you've got a big boiling abscess of depression, go talk to somebody. And there are some things that the process of therapy really can help. Medications are an option, and as hard as it is to get guys to come in, sometimes guys are more likely to be agreeable to a medicine trial because, I don't have to sit down and come in and talk to somebody regularly. Well, you sort of still do. I mean, in my practice, I still do at least 30-minute medicine check follow-ups where we're doing some supportive therapy and some cognitive behavioral therapy in addition to the medication management, because that is what gets the best outcomes. But there are medicines that really do address the core symptoms of depression and reduce, uh, consistently. I mean, you may not get a medicine, you're not going to get a medicine that you take once and then tomorrow you feel great. That's called crack cocaine. And it just is you may feel great for one day and then you're going to be way, way worse. And that's the self-medicating pattern. But there are medicines that will actually over time build up those neurotransmitter systems. So really help to build up the serotonin systems, the norepinephrine systems in the brain, that will start significantly reducing symptoms in 2 to 4 weeks, and really help the guy that's grappling with this to then their own coping may kick in. Most of the people that I work with that have depression have really good coping because they've they've learned to deal with some of the ups and downs of their mood over time. And then when the medicines kick in and you get that 50 to 70% reduction in symptoms, so the symptom intensity starts to drop,
Hmm.
then their own coping kicks in. And it's kind of like the abscess healing. It's like, you get the antibiotic and you suppress the infection enough with the antibiotic, and then the body's own healing powers kick in and things start to get a lot better a lot quicker. And that's kind of how I think about medicines and depression. And so there are various, SSRIs, SNRIs, serotonin reuptake inhibitors, norepinephrine reuptake inhibitor. There are several medicines now that are options.
When you think about early intervention, it's extremely important. Men, it seems like, just from studies, are 4 times more likely to commit suicide. So, what are the warning signs that healthcare professionals, spouses, adult children can see in the men and in their dad, or in their life, to help with uh, curbing that?
Yeah, I think being aware of that, those intrusive and persistent symptoms, sadness, hopelessness, ruminating negative thoughts, especially when they start to escalate into those um, hopeless thoughts, thoughts of just ending it all, not wanting to be here, those kinds of things are the persistent, when those things persist. I think family members definitely have to uh, ask, to talk about, say something, ask, check, check on that friend, check on that family member, and ask, just show genuine concern and ask how they're doing, ask about those, man, I've really noticed that you've been really down or really, hopeless. Are you okay? Are you having thoughts about hurting yourself in any way? Because, I care. I'm here. I want, I want um, to be a help. And so I think just asking, um, you know, um, and of course, the individual, if they're really depressed, especially the guy that's really depressed, is going to say, "Oh no, no, I'm fine. I don't want to, you know, I don't, I don't want you to drop, what you're doing for me. I'll be fine." Well,
I don't want to be a burden.
I don't
Sometimes.
want to be a burden. No, you're not. So the family response or the friend response to that is, no, I mean, you're not a burden. I'm here. I can't fix everything, but I'm here. I'm concerned. I'm not going anywhere. Um,
You know
you
what is
know.
a burden? You not letting me help you.
Yes, exactly. So, you engage, and you ask and you check, and many times that in and of itself is incredibly helpful and incredibly therapeutic. I mean, there are a few things when we're talking about suicide that are also key. um, you know just making sure that there's limited access to lethal means. And again, guys aren't going to want to give up their firearms or different
Yeah.
things like that. Some
Yep.
guys aren't going to want to, do that. But I think a persistent and loving family member that says, "Look, I mean, come on, I'm not trying to take away any kind of Second Amendment rights or anything here. I'm just saying, as a friend, I'm a little concerned about the fact that right now in the state you're in, you're sleeping, right next to something that could be deadly, in the middle of the night when your thoughts are clouded by this depression." Um, and so, just having a family member that can, and I mean, if it's a spouse or a child, maybe they can intervene, or if your husband or your father or your friend has a good guy friend that so I think sometimes that's helpful. Not always, but sometimes that's helpful. I mean, hopefully most guys have that friend, that buddy, that brother that can just be like, dude, what? No, we're not doing this. Give me
Yeah.
the
Yeah.
taking the pistol home with me today for a while. And, so I think those kinds of things are also helpful. Now, I mean, encouraging the person to seek professional help, encouraging them to, see somebody, and then, there's obviously steps. I mean, if it comes right down to it, where you are really truly fearful that your family member or your friend is immediately unsafe, then you may find yourself in a position where your only option is to call 911, or to try to really get professional and life-saving assistance in truly a crisis situation. But the interventions that we've talked about leading, just asking, just saying something, just checking on somebody, just being willing to say, hey, let's just make sure that in an impulsive moment you don't have access to something that could be lethal. Just those things are incredibly helpful.
Yeah.
Um, you know,
Is that what it is? Is it an impulsive moment? It's like you're at a low and you just can't for in that 10 seconds, you just can't see a way out,
yeah,
and
yeah, yeah. The vast majority of times, I mean, there are, each clinical case is, I guess, unique in its own way, but in the vast majority of cases, the research supports the fact that it is especially with guys, it is a moment of painful despair and an impulsive act.
mhm,
And so if you can really, really reduce, if you can create space, if you can create just a little bit of time to help that person have to stop and think, a lot of times that is life saving. Yeah.
wow. Do men have trouble processing their emotions or just expressing them?
Both. Both. I mean, that's a great question. Both. A lot of men have difficulty processing their emotions because they've grown up and been acculturated to be the unemotional kind of problem solver, to just, like, very rational mind, just do this and fix this, solve this, work hard, push through, rub a little dirt on it and I'll be okay, just keep going. And that whole process um does perpetuate and reduce the ability to really learn uh, normal, healthy emotions, and how to, like, recognize when our emotions are, you know, shifting or changing. Like, one way for guys to think about it, that is, I think, a good analogy. I mean, that we may have talked about before, in some of our sessions, but emotions many times are just like, warning lights and gauges, on a car or your boat, or whatever. But a lot of guys, just over time growing up, they just learn what they learn is how to put black tape over the over the warning signs, is about all they learn about processing emotions. um, and just keep going until the engine blows up, and so emotions, like learning how to step back and recognize, oh, wait a minute, this feeling, this sadness, or this sense of hurt, or this sense of guilt or shame or anger is telling me something. It's a warning sign. It's a gauge of something. Let me step back and learn what that signal is telling me. And then the better you are at doing that, and it goes hand in hand with being able to express that, then being able to share with somebody, because that's actually how we get better at processing it too, right? Like we're,
Right.
like, man, I don't know what this means, but I have really been, last couple of days, I've been, feeling really angry, and then, if you've got somebody that's, you know insightful about emotions, that is able to go, yeah, okay, let's talk about that. What's there, what's the things that's been triggering that, what are the other emotional states that are going along with that, because there's always more than one emotional state. Anger is the one that tries to drive out every other emotional state, but really, what I always tell my patients is, you have to realize that there's always multiple emotional things going on, and the better you are at least identifying two, if not three emotional states, the better you become at, keeping an eye on the engine. You're checking all the gauges. Yeah.
This is an interesting question, but how would you define masculinity? And maybe I can make it an easier way to respond by saying, what is healthy masculinity?
Yeah. 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 Wow. That's a topic in and of itself. A great question. And it's a topic, I mean, that is just so all over the place in our culture right now. And I'm, with, fear
That's
and
part of it, right?
trepidation.
Because it does seem that there's been a feminizing of men and a masculinizing of women.
Yeah.
But then what we're talking about, some of the reason why there's so much resistance, actually, it feels like the most masculine men are the ones that traditionally, by cultural standards, especially in Southeast Missouri where you're at, are the ones that are most likely to uh, resist having therapeutic treatment or talking about their situations, right? So
Yeah.
if we're talking to that crowd, that group of people that you see coming into your office or maybe need to be coming into your office, how
Yeah.
would you describe what is the healthiest version of masculinity?
I feel like that's a great question. And to me, I think healthy masculinity, um, in a sense, is a willingness to be strong, a willingness to be tough. That, to me, that's not a bad thing. It's not bad
But not
for
aggressive or dominant.
right, right. And here, I mean, to me, you know, Tyler, I mean, that's where whether the listeners see it as, uh, you know, divine, word from God, or just wisdom of the ages. But to me, I still feel like in some ways, some of the Christian scriptures pointed out. I mean, and probably the scripture that I think is most significantly misunderstood, and has been probably perpetuated by men throughout, a century or two of, Christian literature, is the literature, or I mean the scripture about submission. And, wives, submit to your husbands. I mean, you're right. I mean, how much has that been distorted?
Right.
But to the topic of masculinity, I think people have to understand it. Yes, it does say, wives, submit to your husbands, but it says to the man, husband, die for your wife. Like,
Mhm.
you're held to an even higher standard, in a sense of, you have to be strong enough, that you're willing to lay down your life,
Yeah.
which means, when the bullet comes, you're taking the bullet, but it also means when there's tough decisions. I mean, I can use Paul and I as an example. We've run a business together for years. I mean, does she submit to me? I mean, well, yeah, but do I submit to her? Yeah, it
Mhm.
would be stupid for me to make some of the decisions that she's much, much better qualified to make.
Right.
But my role, the masculinity part, not that she's not willing to lay down her life for me, she does all the time. But the masculinity part is also when there are some tough decisions to make, and we're both going, I don't know, man, this is risky. Something, I'm not sure how this is going to go. And somebody's got to make a call. I may be the one that has to step up and make the call, which doesn't mean that, oh, I'm the boss. It means I also carry the weight. If that thing fails and
Yeah.
hurts us, I carry it.
It's
I take,
leadership.
you know, and to me, and again, I don't know how that plays in our, woke society and all that, but that's how I see, healthy masculinity, and how I think it plays into like men and depression and all of that is we have to we have to like, if I'm doing that completely in isolation from Paula or from other men, I can't do that. I can't carry that. It is gonna make me depressed. But when I do that with Paula, who is incredibly strong and independent, and but also submits ultimately to God, not to me. The real pattern is as she submits to God and I submit to God, we are submitting to one another, and we're stronger. We're not weaker. I'm not taking anything away from her. She's not taking anything away from me. We're we're stronger
Yeah.
to stand. And I don't know if that helps. Hopefully that helps somebody
Well,
out.
you're reframing strength not just as physical toughness, but leadership, resilience, integrity, and also having the ability to be empathetic and caring and compassionate.
Yeah,
I think you defined it well. I know
yeah,
it was a tough question, but I do think some of the resistance, like I said, is because the just perception of what masculinity is, and then the erosion of some levels of masculinity culturally makes the ones that actually want to put their fork in the ground on being a masculine man prevents them from leaning in even more so now because of what's happening
yeah,
culturally.
yeah.
And so I'm just saying there's a world where both of those things exist. I mean,
Yes.
there has to be, right, a world where both of those things exist, where you can express yourself, but also you don't detriment what it means to be a man.
Yeah, yeah, exactly. And I think that's to me that is important as we raise boys in our culture to become, healthy men who understand how to be strong and submit. Let's face it. Those two words in our culture just seem like they're complete opposites. In some parts of our culture, strong submissiveness, that seems right.
Paradoxical.
Yeah, but that's to me, that's what healthy masculinity is. Uh,
Into those life transitions, marriage, fatherhood,
yeah,
retirement, aging,
yeah,
all of those things can affect mental health, can affect how masculinity is looked in that season of life. It makes a big difference too.
oh
So
yeah,
being prepared to on that long-term journey. So when you're thinking about care for people that might be dealing with depression, well, that depression might look different after marriage, after children, after retirement, after early nesting, right? If somebody
Yeah.
has a propensity to lean into those things.
Oh, yeah. Yeah. Absolutely, I mean, for lots of reasons, the stressors of each of those, like, life stages in and of themselves can be, feel like a heavy burden, and then the the disruptions of your understanding of your role. Like, like if you thought that this was what it meant to be a husband, and then you're in a marriage and that's not at all your wife's idea of what it means for you to be a husband. That's going to create some real struggles if that need to be worked out. And if you don't work them out, that's a source of depression. That can be a source of real, you know, de- depression and stress. Same thing with the role of a dad. I mean, if you go into it and you feel like this is what it means to be a dad, but you don't work it out within the context of your family. Again, it's not that your kids get to define you, it's a strong submissive relationship. I mean, I am here, um not, I mean, that's another scripture reference, right? Train up a child in the way that they should go, train up a child in their own bent and God-given design and giftings. I mean, my job hasn't been to make Garrett and Aaron and Josh little Brads. My job has been to be submissive to them and to God's design in their life
Mhm.
and be a part of nurturing their growth and development. But if I am too strong without the submissiveness, when they hit adolescence, I mean, we're going to have, battles and their transition out. I mean, my kids have already transitioned into adult life, but that it becomes this rebellious leaving the nest because, man, my family, my dad just doesn't get me or understand. Um, and I mean, that's a whole other topic too. We have normalized that. We have it in our minds, in our culture, at least in some areas of our culture, that that's normal.
Yeah.
That all adolescents, especially adolescent guys, butt heads with their dad. And I mean, to some extent, that's true. I mean, it happens. Conflict is normal, but it shouldn't be normal that there's this fractured relationship as a part of leaving the nest. No,
Right.
that's not normal at all. Not healthy at all.
We talked about a lot of things today.
Yeah, yeah, yeah.
Any final words?
We did cover a lot. I mean, probably to draw it back to, I mean, just get listen to people that care about you, when they come to you and say, "Hey, I'm concerned. Are you okay?" Be honest with them. Tell them what's going on. Tell them what's going on, and be willing to find good people, good professional support. That's great, but also, listen to your spouse. Listen to your buddy who comes up and says, "Dude, what is going on?"
Mm.
Um, you know, um, they're coming to you because they're seeing stuff and they're concerned. So pay attention and get some help and get some support.
Well, very good. And if you're watching and you're interested in making an appointment, you can call 573-334-7055. You can also visit us online, bradrobinsonmd.com. We have a whole thing of resources on there called The Compass. You can click on that, learn more information about us, and hope to hear from you soon. Thanks for watching.